This medication contains two hormones, an estrogen and a progestin. It is used by women to help reduce symptoms of menopause such as hot flashes and vaginal dryness. The progestin or progesterone in this medication also helps to reduce the risk of cancer of the uterus, which can be caused by using estrogen. Women who have had their uterus removed do not need the progestin or progesterone. This medication may also be used by women after menopause to prevent bone loss. However, there are other medications that are also effective in preventing bone loss and may be safer. It is recommended to consider those medications before using estrogen/progestin treatment. If you are using this medication to treat symptoms only in and around the vagina, products applied directly inside the vagina should be considered before medications that are taken by mouth, absorbed through the skin, or injected. Before starting to use Prefest, it's important to read the patient information leaflet from your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist. You can take Prefest by mouth, with or without food, as directed by your doctor, usually once daily. It's recommended to take it with food or right after a meal to prevent stomach upset. The dosage of Prefest is determined by your medical condition and how you respond to the treatment. For the best results, take Prefest regularly at the same time each day. It's important to follow your dosing schedule carefully. Do not increase your dose or take this medication more often or for a longer time than directed. If your condition does not improve or worsens, make sure to inform your doctor. Side effects of Prefest may include stomach upset, nausea/vomiting, bloating, breast tenderness, headache, or weight changes. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. However, it's crucial to inform your doctor immediately if you experience any serious side effects, such as nausea/vomiting that doesn't stop, mental/mood changes, breast lumps, unusual vaginal bleeding, increased vaginal irritation, severe stomach/abdominal pain, yellowing of the eyes/skin, or swelling of the hands/ankles/feet. Prefest may rarely cause serious problems from blood clots, such as heart attacks, strokes, deep vein thrombosis, or pulmonary embolism. Seek medical help right away if you experience symptoms such as chest/jaw/left arm pain, sudden/severe headache, weakness on one side of the body, confusion, trouble speaking, sudden vision changes, pain/swelling of legs, tingling/weakness/numbness in the arms/legs, trouble breathing, coughing up blood, or sudden dizziness/fainting. In the case of a serious allergic reaction, which is rare, seek immediate medical help if you notice symptoms such as rash, swelling of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed. Remember to always consult your doctor for medical advice about any side effects you may experience. Estrogens, whether used alone or with a progestin, can have serious side effects. It's important to talk to your doctor about the risks and benefits of hormone treatment. Estrogens and progestins should not be used to prevent heart disease or dementia. In postmenopausal women, using estrogen with a progestin can increase the risk of heart disease, stroke, blood clots, dementia, and cancer. The risk of serious side effects may depend on the dose and how long it's used. It's important to use this medication at the lowest effective dose and for the shortest amount of time. Make sure to discuss the use of this medication with your doctor regularly, for example every 3 to 6 months, to see if you still need to use it. If you will be using this medication long-term, you should have regular complete physical exams, for example, once a year, as directed by your doctor. Before taking Prefest, it's important to inform your doctor if you have any allergies or if you have a history of certain medical conditions. This includes conditions such as cancer, blood clots, heart disease, liver or kidney disease, high blood pressure, diabetes, and others. It's also important to let your doctor know if you are a smoker, have had recent or upcoming surgery, or if you will be immobile for a long period of time. Using Prefest may also cause changes to your skin, making it more sensitive to sunlight. It's important to limit your time in the sun, avoid tanning beds, and use sunscreen when outdoors. Additionally, if you wear contact lenses, you may experience vision problems while using this medication. It's crucial to avoid using Prefest during pregnancy, as it can harm the baby. It can also affect the quality and quantity of breast milk if you are breastfeeding. Always consult your doctor before starting or stopping this medication during pregnancy or while breastfeeding. When taking Prefest, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's essential to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Don't make any changes to your medication dosage without your doctor's approval. Some products that may interact with Prefest include aromatase inhibitors, fezolinetant, fulvestrant, aspemifene, raloxifene, tamoxifen, toremifene, tranexamic acid, and certain combination products used to treat chronic hepatitis C. It's also important to note that Prefest may interfere with certain lab tests, potentially causing false test results. Be sure to inform lab personnel and all your doctors that you are taking this medication. As for the daily dosage and optimal timing, it is best to follow your doctor's instructions for the most effective use of Prefest. If someone has taken too much of Prefest and is experiencing severe symptoms such as passing out or difficulty breathing, it is important to seek immediate medical help. You can call 911 or your local poison control center for assistance. Symptoms of overdose may include severe nausea and vomiting, as well as unusual vaginal bleeding. It is crucial to seek help as soon as possible in case of an overdose. It's important to remember not to share this medication with others. While taking Prefest, it's important to have regular physical exams and medical tests to monitor your health. This may include blood pressure checks, breast exams, mammograms, pelvic exams, and pap smears. It's crucial to follow your doctor's instructions for breast exams and to report any lumps right away. Lifestyle changes, such as reducing stress, following a low-fat and low-salt diet, maintaining a healthy weight, regular exercise, and quitting smoking, can help prevent or control high blood pressure, high cholesterol, and diabetes, ultimately reducing your risk of heart disease and stroke. Engaging in mental exercises, such as reading and solving puzzles, can help prevent dementia. Lifestyle changes that may reduce hot flashes include avoiding spicy foods, caffeine, and alcohol, dressing lightly, reducing stress, and regular exercise. Additionally, increasing weight-bearing exercise, stopping smoking, limiting alcohol, and eating a well-balanced diet with enough calcium and vitamin D can help promote healthy bones. It's important to consult your doctor for specific advice on supplements and lifestyle changes. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take double the dose to make up for the missed one. When storing Prefest, it's important to keep it at room temperature and away from light and moisture. Make sure not to store it in the bathroom, and always keep it out of reach of children and pets. It's important to properly dispose of Prefest when it's expired or no longer needed. Do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, consult your pharmacist or local waste disposal company for the proper way to discard it. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.